sharp or a dull sensation? Sharp, sharp, dull, dull. Just gonna cross your legs. Sharp. Let's try it somewhere else. Dull, sharp, dull, sharp, sharp. Okay. And then I'm gonna touch you with this cotton wisp and just tell me when you feel the sensation, if you feel it. Now, 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 now. All right. Now I'm going to put this on your finger, on your joint, and tell me what the sensation is, what you feel, and then tell me when you feel it stop. Okay. So vibration? Good. Tell me when you feel it again. Feel it? Feel it? Stopped. Good. Feel it? Good. Alright. That's good. Okay. And just relax your arm. Just feeling for your tricep. There you go. Felt that one strong? It's your bicep. And then back here we're doing your tricep. What was your tricep contracting? Okay, let's do this one. Okay, your forearm flexed with those, so that's good. Okay, and then you can turn back this way. You're gonna do your knees and that was strong. And just relax your foot, okay? I felt the plantar flexion of that one. All right. And then actually, I'm just going to pull your leg up. Just going to listen to your carotid artery. Okay. Good. All right. So now we are going to move on to your skin, and I'm just inspecting your skin for the color, contour, texture, temperature. Any scars, lesions, or tattoos, the distribution of your hair, generally and on your lower extremities, and capillary refill, configuration of your nails, and the angle. Good, and then I'm just checking for edema also, and then in your joints.
Mm-hmm.
Do you have any pain with the movement?
No.
I'm feeling for warmth and tenderness.
Okay.
Just let me know if you feel any pain. And I'm also feeling for crepitus. Don't have any edema. All right, and then now I'm just going to feel for some pulses.
Okay.
And then your lymph nodes back here. Okay. And then I'm going to move back to your pulse behind your knee. And then I'm feeling the lymph nodes. Feeling lymph there. Strong pulses in your lower extremities, which is good. All right, so now what I'm gonna have you do is you can stand up,
Okay.
and take a few steps that way, a few
Sure.
steps back. Good, and then can you walk heel to toe?
Yep.
That's good.
Okay.
And then just stand here, close your eyes.
Okay.
Feet together for about 15 seconds. A few more seconds. Okay, good. And you don't sway or lose balance, which is normal. All right, so now what we're gonna do is move on to some more musculoskeletal range of movement. So first I'm gonna inspect your extremities and your posture. Good posture, symmetry of your muscle mass and alignment of your extremities. And we did no edema, your skin's good on your joints. All right, so and then can you turn around?
Mm-hmm.
Do you mind if I lift your shirt up?
Sure.
Just feeling your cervical, thoracic, and lumbar spine. And then feeling your paravertebral muscles on both sides. Do you have any tenderness?
No.
Okay. And you can turn back around.
Mm-hmm.
All right, so we're gonna do some range of movements. So what you're gonna do is bend over and touch your toes. Good, and then lean back, stand back, good, and then to one side, good, and the other. And then hands on your hips and rotate backwards to one side and rotate to the other. Good. All right, now we're gonna do your shoulders. Can you just take 2 steps backwards?
Mm-hmm.
Okay, so for this one, you're gonna flex up to the sky and then extend backwards and then up to the side. Good jumping jack, that's abduction, and then adduction, back down to your sides. Good cross over and then the other side. Good, and then up behind your head, behind your back and try to reach for your other opposite shoulder blade. Good, now we're gonna do it against resistance. So up, press up against my hands whenever you feel them. Good, and then to the side, up, press down. Good, and then put your elbows tucked in and don't let me press in, don't let me press out. Good, now we're gonna do your elbows. So out, touch your shoulders. Good, and then you're gonna act like you're holding a tray, palms up, flip it over. Good, and then we're going to do like a bicep curl, and then, yep, press up, good, and then palms up to my palms and press, try to straighten your arms out, good, and then now we'll do your wrists. So up to the ceiling, down, back up, inwards, fingers out, good, and then try to pull up against resistance and then try to push down, good. Okay, now we're gonna do your fingers and thumb. Squeeze your fist, extend all your fingers out and your thumbs, and don't let me pull them together. Now close your fingers, don't let me, good. And then flip it over and reach for your bottom of your pinky, good. All right, now make circles with your thumb and each of your fingers. Don't let me break the circle, good. Good, all right, and then now we're gonna do your, you can sit down. Okay, so what you're gonna do is straighten your knees out, pull them back in, and then press up against, whoop, good. And then pull in, good. Okay, and then your ankles to this, and then down like a pedal. And then I'm gonna hold on to your tibia and put your toes together. Try to reach your, and then toes outwards, away from you, good. Okay, then pull up against my hands, press down, good. And then again, try to press your toes in, try to push your toes out, good. Curl your toes, and then extend them. Don't let me curl them. Don't let me extend them. Oh, good. Okay. And then we'll do your hip rotation. Just gonna move it this way, that way. Rotate it in. All right, now press against my hand on your foot. Good. In. Press out.
Okay, let's start with your hands. All right, if you'll hold them out in front of me. All right, your nails they're clean and there's no polish on them. They're clipped. The capillary refill is less than 2 seconds. The cuticles are dry and intact. There's no breakage in the skin. I'm not seeing any lesions or drainage. The color is pink. You're fair-skinned and your skin is warm. Can you grip my hands? Very good. All right, can you do this for me? All right, I'm not seeing any clubbing. Okay, hold your nails together like that for me. Very good. No clubbing noted. All right, your arms are equal and symmetrical. They are warm and pink to touch. I'm not feeling any abnormal swelling or any lumps. You have tattoos, 1 on your left arm and 2 on your right arm. Your radial pulses are palpable at 2+, and your brachial pulses are palpable. There is I cannot palpate the epitrochlear nodes. Okay, can you hold your arms out for me? All right, axillary nodes are not palpable. All right, can you raise your arms above your head, down below, and out in front? Raise them up and down. Okay. All right, can you take your fingers and touch your thumbs? All right, very good. All right, can you do some rapid alternating hand movements? Very good. Hold your wrists out in front of you, bend them forward and back and from side to side. Very good. Okay. Press up against me. Good strength in your shoulder. You have appropriate strength and range of motion in your hands and your arms. Okay, I'm going to check your reflexes now in your hands and arms. Okay. Where's my hand? There it is. All right. Triceps. Good. We're going to do triceps. Good. Brachioradialis. Good. Go over here, just relax this down. Triceps. Good. Brachial. Good. And brachioradialis. Very good. Okay. Now that I'm going to place an object, if you'll close your eyes for me, I'll place an object in your hand. I want you to tell me what you think it is. We're going to sit for stereognosis.
Paper clip.
Okay, keep them closed. And we'll place another object in your hand.
An eraser.
An eraser, very good. Stereognosis is intact. Okay. Going to move on to your head. All right. Your head is normal cephalic in shape. May I palpate your scalp?
Mm-hmm.
Okay. I'm not feeling any abnormal swelling or any bumps. There are no lesions present. There's no odor. Your hair is fine to touch. It's brown in color. It's braided. There's no breakage noted. All right. Your eyebrows are equal and symmetrical, and they're good growth there. Your eyelashes are evenly distributed, and they turn outward and upward. All right, I'm going to palpate your frontal sinuses. Is there any pain there?
No, ma'am.
Okay. Maxillary sinuses, pain?
No, ma'am.
Okay, if there was, I'd transilluminate those. All right, I'm going to check your sclera. Your sclera is white. Your conjunctiva is pink. All right. I'm going to look at the corneas. Just look straight ahead. Cornea and iris are shiny and clear. Shiny and clear. All right, I'm going to palpate your lacrimal ducts. Any tenderness here?
No.
There's no drainage. All right, very good. All right, I'm going to check your long-term memory. Can you tell me who the last two presidents were?
Trump and Obama.
Trump and Obama, very good. Okay. And I'm going to ask you to remember three things for me.
Okay.
Firecracker, window, and textbook.
Okay.
All right, just try to remember that for me. Okay, now what I'm going to do is I'm going to check your Hirschberg reflex, and I just want you to stare straight ahead for me. Okay, Hirschberg is intact. All right, look at your pupils. Pupils are equal, round, and reactive to light. All right, you'll look over, shoulder, the wall, and then look back at me, and then look over again. Okay, accommodation is good. All right. You do the cover, uncover test. Check for nystagmus. Just look straight ahead. All right, very good. And nystagmus is noted. All right, if you would, I want you to, I'm going to check your 6 cardinal fields of gaze, which is your cranial nerves 2, 3, and 6. So just follow this with your eyes, not your head, okay?
Okay.
All right, those are intact. Okay, now I'm going to look inside your eyes. All right. Looking at an angle. Sclera is white. I'm able to visualize the vessels. There are no tortuosities noted. Red light reflex is present. I'm able to see the retina and the optic disc. Red light reflex is present. Vessels are intact. There's no tortuosities noted. I'm able to visualize the retina and optic disc. Oh, what I'm going to do first is I'm going to palpate your temporal arteries. Okay. Now I'm going to listen for some bruise. Your bruise are heard. All right, I'm going to move on to your ears. Okay. Your ears are equally and even distributed and in symmetry with your head. I'm not seeing any drainage or lesions noted. You do have piercings on both ears. There's 2 in each. There is no drainage or crusting noted. If there was, I would take a sample and look at it under a microscope. Your ears are warm and pink to touch. I'm not feeling any abnormal swelling or bumps. All right, if you would take your finger and put it in this ear, I'm going to whisper something in your ear.
Dallas, Texas. Oklahoma City.
Okay, good. All right. whisper test is good. Now I'm going to perform the Weber test. I'm going to strike the tuning fork, place it on top of your head, and I need you to tell me which ear or ears you hear it best in.
Okay. I can hear them in both.
Okay, very good. Next, I'm going to do the Renee test. It's testing for bone conduction and air conduction. I'll strike the tuning fork, place it behind your ear, tell me when you can no longer hear it, and then I'm going to place it beside your ear and tell me when you can no longer hear it.
Okay. Okay, I can't hear it. Okay, I cannot hear.
All right, I'm going to do the other side.
Okay, can't hear it. Okay.
That's good. Bone conduction is half the time of air conduction. Can you smile for me? All right. Can you puff puff your cheeks and then frown? Okay. Facial nerves are intact. All right. Open your mouth and can you say ah? Okay. I'm gonna look inside. All right. Uvula is midline and it raises when you say ah. The tonsils are not visualized. Okay. Can you stick your tongue straight out? Move them side to side. Okay, can you press against your tongue? Can you press against my hand and over here? All right, and then I'm gonna have you press your chin down and then resist press up. Okay, good strength. Can you bend your head back and forth and from side to side? Good neck range of motion.
Start with your blood pressure. Blood pressure is 120/80. Your respirations are 16. Now I'm going to do your pulses. So for the radial, it's going to be on thumb side on the wrist. It is easily palpable. It is a grade 2. Your pulse is 60. Now I'm going to go ahead and do your brachial, and it is pinky side up here on the forearm. It is palpable. It is a grade 2. I would assess that bilaterally. Can you go ahead and pull your arms up? Or pull your sleeves up. I need to assess your arms. So the color is appropriate for ethnicity. The skin is warm, dry. It is intact. I don't see any redness, no lesions, no breaks. I don't see anything like that. I need to do your capillary refill. Capillary refill is less than 3, and now I need to assess for tinting. No tinting noted. Okay. Now I'm going to move to your head. It is the appropriate size for your body. It's perfect shape. It is symmetrical. Head is normal cephalic. I'm going to put on my gloves. So, hair is evenly distributed. It is the appropriate color. I don't see any lesions, no masses, no abnormalities. The scalp is white. Do you have any pain or tenderness?
No.
Okay. Take that off. I'll wash my hands. Alright, and now I'm going to go to your ears. Can you pull your hair back? Okay, they are symmetrical, the appropriate size. I don't see any lesions, no redness, no abnormalities. I would assess that bilaterally. Okay, now can you cover one ear? I'm going to go behind you, whisper a word, tell me what you hear. Okay.
Window.
Okay. Cranial nerve 8 is intact. I would assess that bilaterally. So now I'm going to go to your eyes. So your eyebrows, your eyelashes, they are the appropriate color. I don't see any redness, swelling, no missing hairs. The hair is evenly distributed. Can you close your eyes? Okay, external structures are good. Now, if you don't care, can you pull your conjunctiva down? Okay, conjunctiva is pink, sclera is white. I would assess that bilaterally in both eyes. Okay, so can you look at me and look behind me? Okay. Patient has accommodation. Pupils are equal, round, reactive to light, and they accommodated. They are approximately 4 millimeters. They are equal size and they are symmetrical. Both of them, I would assess it bilaterally. Now I'm going to go to your nose. Your nose is symmetrical. I need to look up your nose. Can you tilt your head back? The septum is intact. The mucosa is dry. The inside of the nose is red, but it's pink, not red, it's pink. Okay, and can you close one nostril? Okay, and then the other. Okay, and now can you close your eyes, close one nostril, and I'm going to do what we call a smell test. Can you tell me what you're smelling?
Alcohol.
Okay. Cranial nerve 1 is intact. So now I'm going to go to your mouth. Can you stick your tongue out? Okay, the tongue is pink, it is moist, it is rigid. Can you move it side to side, up and down? Can you say ah? Can you swallow? Alright, cranial nerves 9, 10, and 12 are intact. Can you, there you go. So buccal mucosa is pink, the gums are pink. Patient has approximately 32 teeth, no dental caries. Can you stick your tongue out? Tonsils are grade 2. Okay, can you follow my pen line? Cranial nerves 3, 4, and 6 are intact. Take off my gloves. I'll wash my hands. Okay, so now I'm going to go down on your neck. I don't see any pulsations. I don't see any jugular vein distension. I'm going to assess your carotid. It is easily palpable. It is a grade 2. I would assess that bilaterally. Your trachea is midline. Now, on your chest, I need you to tell me if you have any chest tenderness when I touch, okay?
Okay.
Any chest tenderness?
No.
Okay. Patient states no chest tenderness. Patient has non-labored breathing. They are able to breathe easy. Let me go to this side. Patient has a normal 2-to-1 ratio. Can you stand up and so I can listen to you? Okay. So I'm going to listen to your lungs. 1, 1, 2, 2, 3, 3, 4, 4, 5, and 5. Okay, I didn't hear any adventitious lung sounds. Can you turn around so I can listen to your posterior lungs? Okay. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, 9. Okay. No adventitious lung sounds were heard. Now I'm going to go down to your 10th vertebrae. 2. Okay. Can you breathe in and breathe out? Patient has equal chest expansion. All right, can you turn around so I can listen to your heart? Starting on the right side, second intercostal space. This is the aortic valve, and I'm going to listen to it. Second intercostal space, left sternal border, is the pulmonic valve, and I'll listen to it. Third intercostal space on the left side near the sternal border is Erb's point. I'm going to listen to that. Fourth intercostal space, left sternal border, is the tricuspid, and I'm going to listen to that. intercostal space, mid-clavicular, is the mitral valve, and I'm going to listen to the apical pulse for 1 minute. Okay, the heart rate was 60, normal sinus rhythm. I didn't hear anything abnormal. Okay, can you go ahead and sit down for me? Yeah. Alright, can you stick your arms out? Patient's arms are symmetrical. Alright, can you roll your wrist? No crepitus noted. Can you move your elbow? No crepitus noted, roll your shoulder. No crepitus noted. Patient has full range of motion of their wrist, their elbow, and their shoulder. I would assess that bilaterally. Now I need to do your strengths. Can you squeeze my fingers? Okay, and now push up and push down. Okay, fold your arms like this. Okay, now wait, push, and then pull. Patient has grade 5 strength in their hands and